Welcome back. On this episode, you finally get to meet Tara. She does exist. I'm just not hiding her away. She's studying hard, but you do get to meet her this episode. And but what we would like to talk to today, I wouldn't say it's so much taboo, but you have one end of the aisle that's like, hell no, not doing it. I'll deal with it later if something pops up. Or the other ones who just cracks jokes, laughs about it, and just goes and gets it done. And then waits several more years to crack more jokes later when they got to do it again. But on this episode, let's talk getting your colonoscopy. It's very important that we get this done. And on this video, we'll share why on an experience that I had and how I almost pushed it off. And it probably could have bit me in the butt later, if you want to say that. What you got to do is realize on some of these videos is sometimes when I speak, I think that I have some funny humor. Wife looks at me like I'm crazy, but being in law enforcement all those years, you see a lot of things, and some things that I find funny. Some people think that I might be nuts, but sometimes you just got to laugh at some of the things you see in life, especially in a stressful job, or you will go crazy and then tend to do other things that I didn't want to do. So instead, I just focused on laughter and got through the career. But on this one, let's talk it. Let's see how we can go about getting more people to make sure they're regularly scheduled this and just to take care of it. The process is not as bad as some may think. Drinking that juice, horrible. After effects of the juice, horrible. But process, it's quick, it's easy, and then you're done for a while. So let's get into this. Let's meet Tara and let's discuss colonoscopies and how it could save your life and how we can use it to prevent cancer. Let's do this. Well, she made it. She's finally here. Tara has arrived. And like I was talking about the intro video, we are going to be talking colonoscopies. Let me ask you something. What are the four, I'm going to not get this right, the four preventable?
No, the four cancers that we routinely screen for. They include cervical cancer for females. That is screened with a pap smear. Breast cancer, that is screened with a mammogram. Prostate cancer for the men, that is screened with a blood test, a PSA. And then colon cancer is screened through a colonoscopy.
So those are the four major cancers that technology now has allowed us to be able to screen for cancers.
All other cancers you don't do routine screening for, like bladder cancer, throat cancers. Those would be cancers that would be found based on a patient having symptoms
later on,
and testing being
and then
done.
They're trying to catch up to the process at that point. And then on all those four, for the most part, it's preventative. So the insurance companies normally will cover that. So it's,
I believe the insurance companies, yes, should cover all preventative screenings. So those four would be considered in that.
And then today's topic is obviously a colonoscopy. Now with the colonoscopy, what are the ranges? Because obviously some people, I know that you told me when I was pushing back at you, like, hey, I didn't want to get it done. You're like, hey, you're turning 50, and just so you know, they just changed the
guidelines. So the guidelines did state to start the colonoscopies at age 50, but they did just recently change, and it's 45, which then placed me in the category of needing it done and not just pushing my husband to do it.
And and that helped push me to do it.
Yes.
And then with the guidelines being at 45 for the youngest, what would you normally not recommend, but what are the guidelines normally for as we age? Like,
well, a colonoscopy, you get differing amounts of time that you have to screen. So some people are lucky enough to get a 10-year pass if nothing was really found. Some people can get a 7-year pass, 5-year, all the way down to like a 3-year pass. So a 3-year pass is usually going to be if multiple polyps were found.
Okay. And would you normally, so you could be in your 70s and probably might actually, the doctor might tell you like, hey, let's do another one. Maybe it might be the
Yeah, for
last one you're
sure.
doing, but just
Based on the amount of
okay,
years, and a lot of times with the preventative screenings, like for breast cancer and cervical cancer, we'll kind of base it on if a patient still has a 10-year life expectancy.
okay,
So a 90-year-old patient, you might not opt to go through those testings.
that makes sense.
But again, this is not medical
Yeah,
advice. We are just
yeah,
talking and trying to give people um, just make you think
information.
about getting the preventative health stuff
Yeah.
done to keep yourself healthy.
A lot of times, if some of the stuff that you hear us talking about, if you find interesting or just want to go to look for more information or whatnot, always chalk to your provider. Don't like off of Tara's advice to make a change, a lifestyle change, just off of her advice of watching a video. I want to make sure that you're going to your provider and getting their opinion on what they think, because they're seeing you every day. So watching a 12 to 15-minute video, you're not want to just run and change things. It's just, we're just trying to give them information out there, make you might think, or you might want to take that information and talk to your provider about the information you learn here. Um, if I can give you a little story, this is what I was talking about with mine, and I am so happy that she pushed me in the direction that she did when it came to my colonoscopy, because I was going to continue to uh, push it a little bit further to the point I didn't want to go through the whole entire process. So I continued to tell her, hey, can we just do the poop in a
The
box,
Cologuard.
the Cologuard, and send it off? Um, and especially we wanted to get that done before we moved to Florida with our providers that we had there. But with that, and with her training and expertise, she's like, hey, if we do that, it's only for 3 years. Then you're going to have to do it again. And if during that process, if they do find something in there, Greg, you're going to have to go do the colonoscopy process anyway, so they can go get it out. So she talked me into it. She held my hand. Of course, I didn't want to necessarily do it. I just cracked jokes about it and went through with it. But luckily, we made our appointment. We were 15 minutes apart, I think. I went in first, and
Mm-hmm.
I got to see her come out all. Medication got to her pretty good, so it was kind of comical. For some reason, on that one, I was able to kick it, and I had my box of apple juice, and I was fine. And then I had to take care of her for a good 40 minutes afterwards and getting a good laugh out of it. But the whole process, she talked me into it. We did it. We booked it. Now, things have changed a little bit. Maybe you can help a little bit. So some of your providers have done a little bit different. Some will just send you to CVS or Walgreens to go get the juice. And
Yeah, a
then,
lot of people remember getting this jug of stuff that you have to drink, which I think they still do that. But I think based on the timing of ours, we did like our own little cocktail. So we had to mix like Miralax, like a whole thing of Miralax with Gatorade, and drink so much at certain times. We had to take Colaze, like a stool softener. We had to take some Gas X pills. I feel like there was one other, but we had this process all laid out for us on the timing of when we had to do all these pretty much over the counter medications. We just went and bought them ourselves and just followed the process, and it worked. And we were
yeah,
able to have our colonoscopies done.
I was a little disappointed because there was no whiskey within that concoction that she made up for us. Um, I'm not going to say that it wasn't great. I mean, I obviously had to hammer that stuff down. I think it was every 15 minutes that
Something like
within
that,
that hour,
yeah.
like we had to do 4 of them within that, and then stay near your friendly toilet and let the fun begin. Um,
Yeah, the prep's the worst part.
the prep was, it was bad. I was getting the chills and stuff through it, but not to be gross, but
No, we don't need to go into details.
hey, I haven't peed out my rear like that even when I had the worst food poisoning in my life. But again, like what she was explaining, that was the worst part of the whole entire thing. The procedure itself, um,
It was very easy.
very easy. I mean, it was. hey, take a deep breath in. And next thing I know, I felt like I had a nice power nap, and they were giving me a box of apple juice. Other than that, like I said, it's just more of the prep going into it, which it is horrible, but it's well worth it. And you get to make prep jokes. She doesn't like hearing them, but Kev, if you're watching, Kevin's the one that told me a lot of this, of the process, because he had one before me, and so we crack jokes about what guys crack jokes about. But so we get our results back. Now, going into it, if I may just talk a little bit about this, I was joking around because I didn't want to do it in the first place, and I kept telling Tara, I'm like, it doesn't matter. I'm going to end up getting the little 5-year thing, so there's no point in me getting the 10-year because I'm just not going to get it. I just know with my family history, I'm going to get. It's not going to work for me. We go through the entire process. Did you want to talk about the how those results came out? Because
Yeah, I really wanted a 10-year. So Greg had just one small benign polyp, no big deal. They took that off, and because it was benign, they gave him a 10-year pass. And then I had a small polyp as well, but it was precancerous. So I'm on a 5-year plan, which was a little disheartening for me at first. Of course, you think I'm younger. I should get the 10-year pass, instead of him. But obviously, I'm glad I did it, and I didn't just push it off until I was 50 or push it off any longer. I mean, they took care of it. It's gone, and I'll just have to go back again in 5 years. So,
and that's why I think it's very important. That's why I'm very thankful that she pushed me to it. Because if you think about it, if I would have done the Cologuard and then let's just say because it was so small, it didn't pick it up, and then I waited 3 years for my next one. If you can imagine in the 3 years, that small little polyp that I had, what could have grown to in 3 years? I mean, it could have turned cancerous in those 3 years. That's why I think it is very important. And just to talk age, like I said, I'm 50. It could have went a different direction. That's why I think it's so important, like how they changed it to the 45. I mean, Tara's 47, and if she would have waited till the old terms of 50, who knows how big that polyp could have been. So if you're turning 45 and going up, crack jokes about the poop juice and all the everything and laugh about it.
but I get it. I mean,
Yeah.
most of the screenings that we can do on the not preventable, but the screenings that we do routinely on the 4 cancers, they put you in a vulnerable position. Like, a colonoscopy, you're in a very vulnerable position. Pap smear for women, vulnerable position. And nobody likes that. I mean, it does make you feel, I don't know, embarrassed and nervous. But again, they made us feel very comfortable. We got the medication. And, especially being in healthcare, the people on the other side that are taking care of you, they are professionals. They do this every day. They are there to take care of you and hopefully help you feel safe with them and not so vulnerable.
Do you find in your experience, like I said, obviously you just got your master's, you have 23 years in the nursing profession. Do you find when it comes to some of the ones that they can screen for that men struggle a little bit harder than women do when it comes to being put in that vulnerable position?
Yeah, I mean, that's kind of a hard question, but thinking about it, yeah, probably because women starting at a very young age, start having yearly pap smears. It's just something, we have to do. They have changed the guidelines, and now women can kind of push it off to 3 to 5 years. But for a very long time, we were doing pap smears every year. A lot of women have babies, do other things that kind of, I guess, do get us used to being vulnerable, where men, don't really want to be in that position.
No.
And I mean, I get it. Even being in healthcare, I did not want to do a colonoscopy. Does not sound fun.
Yeah.
Did not want to go through it. But then when I'm sitting here talking to patients and encouraging them to do it, made me realize, okay, you've hit the guideline age. You're a little actually past it now. So you need to just take care of it.
I think sometimes it's easier for us guys to just laugh at one another, make fun of one another. Sometimes I think it does help because if Kevin didn't guide me through it and make fun of it and crack jokes about it, and now we joke about
Yeah. But you really
the
then you realized
experience.
it wasn't that
No, it
bad.
wasn't that bad at all. That's why we're making this video. So, um, is there anything else that you could think about this? That I mean, the
No, and I would just
experience and
say
just
stay on top of it.
yeah,
Whatever it is, like again, I'm not happy to be on the 5-year plan, but it is what it is. I will be doing it again in 5 years. So just definitely go by the recommendation of your doctor, whatever, whether it's a 3-year,
yeah,
which of course is not the ideal, or you're a lucky one and get the 10-year. Just make sure that you keep track of that and stay on top of it because colon
yeah.
cancer is not something that you want to end up with.
No, not at all. So moving forward, we'll have some more discussions like this in the future. I hope you enjoyed this video. Um, I will put our email address in this video. I believe that I have it down there as the Village's FMP and Sidekick, I think at Gmail, but I'll confirm that. Moving forward, if there's anything that you guys would like to discuss, healthcare wise, Sidekick wise, would be more law enforcement. I don't know a whole lot about the healthcare. She gets annoyed with me because I'm always bugging her, and but that's what she's there for. But moving forward, if you guys have anything, send us an email, questions that we might be able to talk about in the future, whether they're serious, comical, some of the experiences you might have had in the healthcare. And then well, let's learn together and have fun. That's all you got?
That's it.
That's all I got. We're going to go and enjoy the rest of this Florida afternoon, and we will see you on the next one.